first impressions. You had me at hello. You, the front office personnel in our offices, are the first people that our patients see and interact with when they come in. You are usually the first people patients speak to on the phone, unless you work at the main where there are operators. You are the face of access. As the face of access in the front office, those first few seconds set the tone and create that crucial first impression that your patient will have about you and Access Healthcare. This may sound simple and a little obvious, but it is one of the most important concepts you should know and understand in order to be a successful part of the medical office team. And by the way, this also applies if you provide service over the phone. You must work on developing a good, warm greeting to your patients and come from a sincere place. A lot of things can and will happen. They all take place within the first couple of minutes after a patient enters your office. The patient immediately does a visual assessment. How does the office look? Is the place welcoming? Is it clean and neat? See Policy 12.01. Is the information on the walls thrown up there haphazardly? Or is there a rhyme and reason to it that is easy for the patient to decipher? Why is the greeting so critical? When you first greet the patient, you are selling yourself first, Access Healthcare second, and the experience third. You want to get that patient feeling comfortable as soon as they walk into or call your office. This is the first step in patient engagement, and it is the single most important thing that you can do for your office. Put yourself in the patient's shoes. If this patient were you, how would you like to be spoken to? What makes you sit up and take notice in a good way when you go to a medical office? How would you like your parents to be treated? Use what makes you feel special to help make our patients feel that way. On the phone. If a patient is calling the office for the first time, this is another first impression moment. You are interested in them and the reason for their call. Listen. This is very different from hearing. When you listen, you let the other person tell you what they need to say, and in this way, you make them feel that they matter. If this call is from a new patient, you should welcome them and thank them for choosing us to provide their care before you do anything else. You need to see who, if anyone, referred them to us, and you'll need to get some vital information that'll be used to set up the appointment into the system. Be patient and go slow with them. Remember to let them know about the patient registration packet of information that they will be asked to complete before their appointment. Let them know that they can pick it up at the office, get it online at ahcpllc.com, or fill it out in the office on the day of their appointment. But do make sure to let them know if they choose the office option, they should arrive there 30 minutes early. Be sure to ask if they need directions to the office and let them know that we are looking forward to meeting them and taking on all their healthcare needs. If this is a returning patient, once they identify who they are, let them know that you welcome their call and then listen to the reason they are calling. Speak to them by using their name. Respectfully use their last name. Always thank them at the end of the call after making sure that you've done whatever it is they needed or provided whatever resources that were necessary to meet the reason for the call. Stay tuned. The next modules will go into telephone etiquette, customer service, and handling appointments.